Hi, I'm Selena and I'm from Pain-Free Physiotherapy and Line Health. Do you have bad pain, pins and needles, and numbness that goes from your neck down to your arm? Do you have stiff and painful neck? Do you have hand weakness that stops you from holding your pen? If yes, this video is for you. You may have a condition known as cervical radiculopathy. Cervical radiculopathy is the damage and disturbance of nerves function that results if one of the nerve roots near the cervical vertebrae is compressed. There are two types of radiculopathy. The first one is the true nerve radiculopathy, and the second one is the somatic referral radiculopathy. Depends on which type, they have different causes. The true nerve radiculopathy is caused by the compression of the nerve roots. The somatic radiculopathy is caused by a dysfunction in the muscles or joints that mimic symptoms of a nerve root compression, which can be treated by conservative manual therapy. Clinical experiences indicate the vast majority of the cases are caused by somatic referral, which means the vast majority of the cases can be treated effectively by physios. Depends on which nerves are involved. People who have cervical radiculopathy can present with different symptoms. For example, pain that spreads into the arm, your hand, the chest, the neck, and even the upper back, pins and needles, and muscle weakness and numbness in the hands and arms. Some doctors and physios may not consider somatic referral as one of the possible chances for people to get pins and needles. Instead, when patient comes in with pins and needles, some physio will tend to relate it straight away to true nerve damage and will refer you to doctors for surgery, steroid injections, and medications. At Pain-Free Physio, we use a holistic approach to assess your body as a whole and treat your symptoms rather than just focusing on your neck and arm area. We'll perform a head-to-toe examination to look for all the contributing factors. If your radiculopathy is a somatic type, we will find the root cause of your problem. Most of the time, the root cause is not in the neck or in the arm, but in somewhere else. It can be anywhere in the body. For example, the muscle behind your shoulder, in the upper back, or in front of your neck. So, if it's the somatic type, which accounts for the vast majority, clients can be treated by having manual therapy muscle release on that specific structure and by complying to the prescribed exercise that we would teach them in the session. As mentioned before, if we found that your condition is a somatic referral condition, then we'll provide hands-on manual therapy to release that particular structure out. Let's say subscapularis, a muscle in front of the shoulder blade, is the root cause. This is what we will do.
Okay, so let's talk about subscapularis. Okay, so it sits in the subscapular fossa in the front of the scapula. This one you will need to go through the armpit. So we have the patient arm abduct like that, okay, and you can feel with your finger, okay, on the anterior edge of the scapula. So if the scapula is like that, I want to go to the anterior surface of the scapula, subscapula of the scapula, so where the subscapularis muscle sits, okay. I can move the arm a bit more, like into abduction or elevation, okay, to feel if the muscle pops out, okay, into my finger. Or I can protract the scapula so I can go to the deeper layer, okay. And then if it's tight, it will feel quite ropey on my finger. And it can be quite tender as well. Okay. And once you find that muscle, if it's tight and you want to release it, you can just stay in that position, or you can just relax this arm and still having the treating hand in place, and you can do a small like scalp circling on that muscle to fix it.
Or, depends on your presenting condition, we'll also apply other treatment techniques during our treatments, providing a taping technique on one of the muscles on your shoulder, the upper trapezius muscles.
Facilitation for the upper trapezius. So you often have people with dropped shoulder. Okay, so the scapula may be downward rotate because of a tight levator scapula, or some people may have the whole scapula depressed because of our weak or long upper trapezius muscle. So in both instances, the shoulder would appear low and the patient's neck would appear very long.
Because they have dropped shoulder, the tension in the brachial plexus can increase, leading to pain and all the other symptoms. By doing this taping technique, this tape would deload the tension on these structures and to deload the brachial plexus tension.
So you identify the inferior angle. So you wanted to tape up. Okay, so the white tape close to the superior angle. Okay, and then the brown tape can be a little bit shorter. So what you need to do is to shrug the shoulder up, so you can see there's a lot of wrinkle on the white tape now. Okay. And then you just pull it up, and very quickly you put the tape on, the anchor tape on. Okay. And that will make the left shoulder higher, so the patient will feel there's a traction, upwards traction.
So, if you suspect you have cervical radiculopathy, feel free to talk to us and we'll be happy to answer your questions and tell you what we can do to help.